quickly. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم والشمس وضحاها والقمر إذا تلاها والنهار إذا جلاها والليل إذا يغشاها والسماء وما بناها والأرض وما طحاها ونفس وما سواها فألهمها فجورها وتقواها قد أفلح من زكاها وقد خاب من دساها كذبت ثمود بطغواها إذ انبعث أشقاها فقال لهم رسول الله ناقة الله وسقياها فكذبوه فعقروها فدمدم عليهم ربهم بذنبهم فسواها ولا يخاف عقباها صدق الله العلي العظيم. So this mental health seminar has been organized by Al Murtaza to increase awareness about mental health issues. This seminar is also being broadcasted online through YouTube on Al Murtaza channel. So if you have access to it, please you can watch through that if you are sitting at home. And if you want to ask any questions, you can go to a website called slido.com, spelled as SLIDO.com, slido.com, and you can type in the number 720174. So think of the seventh Imam, 720174, and you can post your question. That question would come to us anonymously, so we would not know the identity of the person who is asking the question. And if you have any question, we can then put forward to our physician and the ulama who are present here, and then you should be able to get your answers. So the two things online, if you're at home, you can go to YouTube channel of Al Murtaza and watch it over there. And if you have any question, you can go to slido.com and dial 720174 to ask your question. It would come to us anonymously. Let me start by introducing our panel of speakers. We have Dr. Mustafa Azadi, who is a psychiatrist, and he will be speaking. And then we have Dr. Sadaf Javed, who is a pediatric psychiatrist. Because of an upper respiratory illness, she could not join in person, but she is available to give her speech through telephone. So we will be listening to her just online. She would not be physically present, but we should be able to listen to her, what she has to say. And then we have two esteemed ulama, Maulana Yasir Naqvi and Maulana Shamshad Haider, who would also be giving their valuable remarks. So why is it important to talk about mental health? Let me start by talking about a news item that came last year. So in Allen, Texas, which is a suburb of Dallas, police responded to a call to a home around 1 a.m. Somebody had alerted that maybe a person is suicidal. So the police reached that spot at home, and they found 6 family members who had been killed. It was a murder-suicide. The police was tipped off by a friend of one of the victims who had discovered a letter that was posted on Instagram. And the title of the letter was, "Hey everyone, I have killed myself and my family." So this was in April 2021, not far from here in Dallas, Texas. The 6 victims that were discovered in that home were 2 parents, 1 grandmother, 1 younger sibling, 1 daughter, sister, and then 2 young boys who had perpetrated this. They were 19 and 21 years old. They had been students of UT Austin. So the 2 brothers were clinically depressed, and among themselves they had decided they would commit suicide. But they said if they commit suicide, it would be very terrible for their parents and their sister, to cope with that. So they decided to kill the family first and then kill themselves. And they This family was a Bangladeshi immigrant family, like many of our families. They were Muslims, by background. So this is a very serious problem which is prevalent in the society and even in our communities, and it's very important we pay attention to it. And it's not just in our family. Generally, in US, about 20% of the population have mental health issues. About 50 million Americans have serious mental health issues. You must have also, and about half of them don't get any treatment. So it's actually a very common problem. A lot of people have mental health issues. They are often not aware that they have this issue. For example, somebody has an anger issue or personality disorder or depression or anxiety. And they just think that that's how they are. Without having an insight that this is a health issue which can be addressed once identified through a variety of means. Also, you must have heard that, especially with this COVID, lockdown, there have been numerous cases. In fact, 500% increase in incidence of people having unruly behavior when they are flying. So, because of their underlying whatever health or personality issues that they have, mental health or personality issues, when they are placed in that aeroplane for 3 hours or 5 hours, many of them just lose it. So, which brings out that they have something going on. So these are important health issues. So we have organized this seminar to discuss some of this, and what I want to do is next is invite my first speaker, which is our own very community member, Dr. Mustafa Azadi. And let me just pull out his introduction quickly so I can tell you. He is hailing from Pakistan. He comes from Pakistan. He went to medical school over there. He's a board certified psychiatrist with extensive experience in various clinical settings. Currently, he is working in a private health setting in which he is dealing with an inpatient psychiatric unit, and he's giving advice to mental health issues for depression, anxiety. He also specializes in substance abuse. He's a very active community member, and he's going to give us 2 talks. The first talk is going to be about depression. So what I want to do is go ahead and invite Dr. Mustafa Azadi. Please come, and if you can enlighten us with issues on depression. The other thing I forgot to mention is Dr. Jafri is also moderating this event with me, so he'll be available as well. He'll be taking your questions, so we'll ask him as well. So let's welcome Dr. Mustafa Azadi.
Assalamu alaikum, brothers, and if there are sisters listening online, so assalamu alaikum to all of you. I think this program is also going live online, so if you guys can go to the Al Murtaza's live stream, and you can let your family members aware of this opportunity also. Inshallah, as Dr. Hasan mentioned, it was his, I think, all the efforts to organize this seminar, and it's the need of time, and I think we have been seeing the rise in mental health problems throughout the communities, and especially in our community. The background that we came from, like the India, Pakistan, and the subcontinent, it is considered as a very stigmatic topic. People do not talk about this mental health issues as openly, and they try to just kind of suppress this issue instead of addressing it and acknowledging it. Because for any condition to get treatment, you have to first acknowledge, and you have to kind of admit that you are dealing with some problem. Until and unless we are aware of that something's going wrong, only then we can get some treatment for it. So we have decided a couple of topics, since this is our first seminar for this series, and inshallah we'll be doing more of these kind of seminars in the future at different centers. So my topic is depression. Depression is very prevalent in our society, but first we need to understand what is mental illness is, what mental health is. Today we will be discussing these key topics, these main topics, and under these each individual topic we will go in further detail. So what is mental health? What is mental illness? Then how can we tell somebody is having a depression or just a normal sadness? And then we will dive into depression, what are the signs and symptoms, and other specifics of the depression. So mental health, like our physical health, mental health is also very important aspect of our well-being. And when it comes to mental health, we always think of maybe it's a mental illness, but mental illness and mental illness health, they're different things. Like for mental health, our emotional, psychological, and social well-being is called mental health. Like, and we can have a good mental health, a poor mental health. Like good mental health, so we have to do certain things in order to keep our mental health in a stable state. Like for physical health, we have to make sure that we eat right, we have good eating habits, good physical activity, and all those things. Similarly, for mental health also, we need to focus on our emotional, psychological, and social well-being, because it affects how we think, how we feel, how we act, and it also helps determine how we handle stress, relate to others, and make healthy choices. So if we come across any stressful moment in our life, if we are in a good mental health state, so we will be better able to handle that stress in our life. Otherwise, people can fall apart in the face of any stressful situation in their life. So we can see like if one is stress, for example, somebody's dealing with a stress in their life, and two different individuals can respond completely different to the same stress. So it depends on like how good of their mental health is. If somebody is in a good mental health, so they may be able to handle that stress better compared to someone who is in a poor mental health. Okay? So, and like again, I will be keep going back and forth and giving the analogy about the physical health, because it's so easy to understand from the physical perspective, because we give so much importance to our physical health. For example, if I have a pain, I will just go immediately take some Tylenol or something. Or if it's a severe pain, then I'll go to the doctor, go to the ER to address it. But when we are hurting emotionally, we just delay it to the last minute, because people cannot see it, especially people who are around us. Yet they will think, okay, physically we are just fine, like this person is just fine, what's going on with him? They will, because of lack of awareness of mental health, they will just give us like negative comments and probably put that person even more down and make him more depressed, because they will not be providing the support that the person needed at that time. Okay, so mental health, according to the WHO, the definition of mental health is a state of well-being in which the individual realizes his or her own abilities, and he can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. So it is very important for community as a whole also. If we are in a good mental health, we have a state of good mental health, so we can be productive members of the society, and we can be lot more service to the community. Versus somebody who's in a poor mental health or dealing with mental illnesses, it can be a burden to the society, not like that in terms of like, because he cannot be productive member. So we need to provide more support to that person and bring him out of that mental illness. So again, if you look at this picture here, it says that mental health is as important as physical health. In fact, I would say it is even more important than the physical health, because when somebody is hurting physically, it will be only contained to him. If somebody is having pain or having high blood sugar or high blood pressure, people around him will not know like he's like having high blood pressure or high blood sugar, unless he say, okay, I'm having this symptom, having a headache or some other symptoms of that condition. But if somebody's mental health is affected, everybody who's surrounded, like 360 degrees related to him, whether it be at work, at school, at community level, will be affected because of his mental illness. So it is even more important than the physical health. So now we talk about mental illness. So mental illnesses are health conditions, like our physical health conditions, but they involve changes in emotion, thinking, or behavior, or a combination of these things. So it affects our emotions, our thinking, and behavior. So when our emotions are affected, obviously we will be feeling sad, we'll be like more than just sad, like feeling depressed, anxious. It affects our thinking. And for any given situation, like negative thoughts will be occupying our mind. And we will be thinking negative of everything. It will be hopeless situation. And affects our behavior. We'll be more irritable, more agitated. We will not be like, people will be walking on eggshells around us, like because it affects our behavior also, how we behave in certain situations. So mental illnesses are associated with distress and or problems functioning in social, work, or family activities. As I said, like it'll be affecting everything that we'll be doing. But the most important thing is mental illness is treatable. So it's not like that somebody has a mental illness, we can just give up on him. No, we have to provide a lot more support than we care for somebody who is dealing with a physical problem. So if you look here at this picture, it shows some, like what is mental illness, as we discussed, that it affects our thinking, the feeling, like you can see in this picture, this person's like crying and laying in the bed, and our behavior, like throwing things around and like people will not feel comfortable around that person. It's a mental health condition that has negative effect on the way an individual think, feels, and behave. Okay, so it's a common question, like how we can tell, like if this person is going through their emotional changes, or it is some mental illness. Because these emotions that we all go through since our birth, because it's very inherent or natural for us, whether it be happiness, sadness, anger, being worried. So how can we differentiate between if it is a normal human emotion or if it is some mental illness? And since we are discussing about depression, so that common emotion comes in depression is sadness. Okay, so sadness, it is a normal human emotion, as I earlier mentioned, which can be caused by loss or absence of a loved one. We just had a death yesterday in our dear community member. You can see that there was sadness prevailing in the society. Everybody was like feeling the loss, right? So that's sadness. So loss or absence of a loved one, divorce, loss of a job or income, failing an exam, or issues at home can all affect mood in a negative way. And it usually passes with time. Like you can get over those losses in your life, because like again, like this brother, it's a very dear brother, but people will move on. Like the intensity of their sadness which was there yesterday will be much less in today. Obviously, his family members will feel it a little bit more for a longer time, but like the community at large will move on from this loss. So it usually passes with time, and it can relieve from crying, venting, or talking like about the frustration. Often has links to a specific trigger. So there's usually some trigger when we are feeling sad. It's not like that we are feeling sad for no reason. If the person becomes unable to resume normal function, this could be a sign of depression. Okay, so here we can differentiate between sadness versus a mental illness, which is depression we are talking about. That if the person is not able to resume their normal function, if it is affecting their functionality, again, then it's a sign. Okay, we need to be concerned about. Okay, maybe this person needs some proper assessment, and then if it is something depression, then we can, again, it's a treatable condition. So if low mood gets worse or lasts longer than 2 weeks, then person should talk to their doctor. So if the symptoms are persisting for more than 2 weeks and is affecting their functionality, then something needs to be concerned about. Okay. So look at this cartoon here, which again shows the difference between sadness and depression. So on the left-hand side of your slide, you can see this kid is saying that, God, I studied so hard, and yet I could not pass my exam. So this is like more of an example of a sadness, because he worked so hard, he was not able to get the desired results, so he's feeling sad. But on the right-hand side, you can see there's a conversation between these ladies. He said, my son seems to have lost interest in his studies. It has been a month since he's gone to college. He does not speak to us at all. I'm really worried. So you can see it is lasting more than 2 weeks. It is affecting the functionality. And the parents can see the obvious change in that individual. And then this kid is saying here, my parents are always quarreling, and this bothers me so much. I don't feel like studying or doing anything. I don't have a future, and I hate my life. So he's been hopeless in his situation and helpless feeling also. So withdrawing from family and friends, loss of interest in activities, these are more of a sign of symptoms of depression. So what is depression? We've been talking here about depression and sadness. So as we earlier discussed, sadness is just a response to a normal loss or grief or any stressful situation, and it usually passes with time. But depression, let's see what depression is about. Depression is a mood disorder. It has a persistent feeling of sadness and loss of interest. And it is also called major depressive disorder or clinical depression in layman term. If it affects how we feel, think, or behave. And it affects cause emotional and physical problems, because we can have physical problems because of depression as well. We know about the emotional problems. Then we have trouble doing normal day-to-day activities. And again, as I earlier mentioned, it affects our functionality. So sometimes you may feel as if life is not worth living. So people can have these hopeless situation where they will feel that nothing seems to be working out, and then they get to a point where they can have these negative thoughts like the suicidal thoughts. And what's the point of living if there will be no difference to anybody if I'm here or not? These are passive thoughts. Then if it goes further ahead, like a deep in depression, they can start having active suicidal thoughts and start making plans about things, how to end their lives. So, and suicide is a big, big problem in the society, and we will discuss about it later in the presentation. So look at some signs and symptoms of depression so that we can educate ourselves, and if we see these signs and symptoms around us, so we can approach those individuals. And it is very important aspect of mental illnesses, because people do not, first and foremost, do not acknowledge who are going through their depression or any mental illness. So family members, they need to play their role. Like person who is close to that person, they need to provide the support to them. And if they are themselves educated in that, so they can educate the patient so that they can get the right help. Because the longer you go without getting the proper help, the more damage you will see in the family, especially for that person, because again, it affects everybody who surrounded that person. So signs and symptoms of depression are, it should be there most of the day, nearly every day for at least 2 weeks. So the symptoms are persistent. It's not just like you're feeling down today and you'll be up next day and you move on with your activities. So symptoms will occur most of the day, nearly every day for at least 2 weeks. And it can last longer. People can be in depression for weeks, for months, especially if they do not get their treatment, right treatment. So symptoms are persistent, sad, anxious, or empty mood. So they will not have any emotions. They feel so empty. Nothing will be of interest to them. They will lose interest in everything. So feelings of hopelessness or pessimism and irritability for no apparent reason. They will be just irritable without any trigger. Feelings of guilt, worthlessness, or helplessness. They will think of very negative of themselves. They're very low self-esteem. They just will feel that they are of no good. Loss of interest or pleasure in hobbies and activities. The things they used to enjoy, they will not be doing those things, like visiting family members, going out with the friends, their studies. So nothing will interest them. If they used to play some sports, so decreased energy or fatigue also. And it will be hard for them to carry on with their normal daily tasks. It's like even brushing, taking care of personal hygiene will be a chore for them. They will feeling so tired, they don't want to do anything, lay around in the bed. Crying spells. Okay, moving or talking more slowly. The medical term is psychomotor retardation. Like they cannot just move or moving, they're so slow. And again, like families who do not have good education or awareness about mental illnesses, they will be asking patients like, what's going on with you? Like, why are you so slow? Why are you not moving fast? Because this person is going through so much trauma and like the problems within him, and the other person on the outside, they see you're physically just fine. What's up with you? So it is very important. Again, I'm keep emphasizing the role of the family members around that patient. So feeling restless or having trouble sitting still, difficulty concentrating, remembering or making decisions. So their executive functioning is also gone. So cognitively, they are pretty, they'll see lots of problems with concentration, remembering and making decisions. Then they have difficulty sleeping. They have early morning awakening or oversleeping. They have difficulty falling asleep or staying asleep, or they're sleeping all the time. The appetite, it can go up and down. They will be either eating too much or not eating at all. Then there will be thoughts of death or suicide attempts in the past. You can also see that. Then the physical aspect of the presentation of depression will be their body will be aching, like they will complaining of pain, headache, cramps, some GI problem. Kambar uncle is here, he can emphasize more on that. I'm sure see lots of patients coming up with the mental health issues, coming up with the GI problems. And the clear physical cause would not be there, like that you can address these complaints for. Okay, so this is again some pictorial representation of the signs and symptoms. So this person, helplessness, guilt, anger, withdrawing from friends and family, problems with concentration, thoughts of death, changes in appetite, energy loss, sleep problems. They also can resort to drugs and alcohol because they're so miserable, they go towards anything which can relieve them from this pain. And we can typically see people dealing with mental illnesses can have co-occurring substance abuse problems also, again, which we'll be discussing later on in our presentation. So causes of depression. And often people will ask why we are having these problems like the depression or any other mental illnesses. So unlike any bacterial infection, for example, somebody has a strep throat, or people dealing with COVID, so you can pinpoint the problem, like, okay, he's having a COVID infection. Because you can isolate that virus. Okay, this is the reason of this presentation. Or somebody having a strep throat, you can just run a test and you can find out that it's a streptococcal infection. But the conditions like depression and most of the mental illnesses, they're multifactorial, like the causes. Okay, it can be genetic, combination of genetic, biological, because of some health conditions or some other problems with the body, environmental factors, or psychological factors. So certain personality traits, such as low self-esteem, being too dependent, like people have dependent personality traits, self-critical or pessimistic, these all are the causes of depression. And again, as I said, it's a combination of multiple things. It's not just one thing which is making a person depressed. Traumatic or stressful events, such as physical or sexual abuse, death or loss of a loved one, difficult relationship, financial problems, they all can lead to depression. History of other mental illness disorders such as anxiety, eating disorders, or post-traumatic stress disorder. We earlier mentioned about the substance use, the abuse of alcohol or other recreational drugs can lead to depression. Serious or chronic illnesses like cancer, stroke, chronic pain, or heart diseases. I'm sure like Dr. Hasan, he is an oncologist and he must see lots of depression in his practice, people going through the cancer. They do present with, when they're going through the cancer treatment, they can have depression at the same time. Okay, so I mentioned earlier that it can be very complex. It can cause lots of problems for that individual if we do not get the right help at the right time. So the complications that we can see because of depression if it's not treated. So depression often gets worse if it is not treated. So we can see the excessive weight or obesity because a person will not be taking care of themselves and they will not be physically active, their appetite will be up. They can have some pain or physical illnesses. We see often fibromyalgia, people complain of just unexplained pain in the body, different parts of the body. Alcohol or drug misuse, they can go towards the addiction problems. Then anxiety, panic disorder, social phobia, family conflicts, relationship difficulties, and work or school problems. I'm keep saying that like the families has to play an important role in the treatment of that person, educating. But it is hard for the family members too. So that's why they need themselves education, how to deal with the person who is suffering from some mental illness. So because it's not easy. It's easy for me to say, okay, yeah, just be supportive to that person. But person who's living with that individual who's dealing with depression or any other mental illness, it's a cumbersome task. And people who do it, we should do as a family member, be there for them, but it requires a lot of, and it can cause like lots of like caregiver fatigue, like person who's taking care of the individual who is depressed or any other mental illness, it can burn them out, so it affects their relationship. So, and the complication again of depression is social isolation. And so it is again like since our religion is such a beautiful religion, it emphasizes so much on like the community or the social obligations. So if we don't see anyone that we used to see, and if he's not there, so it's our duty like to inquire about them. Maybe they're going through depression. Maybe they need some helping hand at that point. So somebody needs to, especially during the COVID era, when alhamdulillah we are out of COVID pretty much, and we never felt the burn of COVID in Texas or especially Houston as other places people have felt. They were isolated for months, and alhamdulillah we have these centers here and the gatherings on the Sadqa of Ahlul Bayt that we get these opportunities to go out and socialize. But there are people who have not seen their family members in months, literally. And especially in other religions, like the people who are not Shia or Muslims, so they don't have these opportunities to go out and socialize. Like we go to Jummah and all these other occasions. So untreated depression can lead to suicidal feelings, suicide attempts, self-mutilation, such as cutting. And I have seen tons of patients, especially the younger teenagers, they will just cut themselves because to relieve the pain. They don't want to die like by cutting themselves. They just cut because they have no one to talk to. They'll just cut themselves, and while bleeding, they're just relieving the pain or the trauma they're going through inside. Then premature death from medical conditions. So these are some complications of depression. And let's talk, Hasan Bhai earlier mentioned about some numbers about the prevalence of mental illnesses. So depression is the leading cause of disability worldwide. It's not just here in the US, it's everywhere. It is the leading cause. And 1 in 5 US adults experience some form of mental illness. Every fifth individual is suffering from some mental illness. It is so much prevalent. And alhamdulillah, the maktab that we belong to, the religion that we follow, with the teachings of Ahlul Bayt, we have so much support and help available in just their teachings that maybe I think it's a big like antidote for all these mental illnesses for us if we truly follow their teachings. So 1 in 21 adults experience serious mental illness. So 1 in 5 experience some form of mental illness, but 1 in 21 experience serious mental illnesses. And serious mental illnesses like schizophrenia, major depression, bipolar disorder, they are considered serious mental illnesses. So 16 million US adults have at least one major depressive episode in a given year. These are staggering numbers. 1.9 million children between the age of 3 and 17 have been diagnosed with depression pretty much every year. And 7 million adults aged 65 years and older are affected by depression. So women are almost twice as likely as men to have had depression. So that's why we have to be very, considerate of this fact that, and our religion also teaches us how to treat women with respect in our household, whether it be our moms, siblings, or the spouses, or daughters, or parents. So we have to be extra careful because Allah have made them so delicate, so they need a special care because they're more fragile. So suicide is the 10th leading cause of death in the United States. 10th leading cause, like among all the deaths, it's the 10th leading cause. And more than 47,000 almost deaths in 2019. It's a given year, like around, and the numbers are going up every year. So a couple of years ago, it was like up close to 47,000 people dying just because of suicide every year. Like one death every 11 minutes, you can see. Okay, in 2019, there are 12 million American adults seriously thought about suicide, 12 million Americans. And 3.5 million planned a suicide attempt, 1.4 million attempted suicide. So it is the second leading cause of death for the people ages 10 to 34. It's the second leading cause. I think the number one is homicide in this age range. Fourth leading cause among people ages 35 to 44, and fifth leading cause among people ages 45 to 54. So it is prevalent throughout all age groups. It's not just but obviously teenagers and the younger people, there are more, and there are multiple factors because they have that energy and the means to kind of complete the suicide also. That is one of the reasons as well. Yes, please.
How does it compare with other countries?
It is more prevalent in Western societies, and especially, but it is everywhere, but not at this number, because since we live here, we know the social problems that we see over here, the disparity in the socioeconomic status, and there's so much unemployment, so much substance abuse is involved. So, but it is definitely higher than other countries. But there are a few countries, especially some in Europe, that they have the higher suicide rate over there.
In Japan also.
Yeah, Japan, lots. Okay, so treatment for depression. First and foremost, what we can do on our own, and again, treatment also has a multi-pronged approach. It is a multifactorial problem because it has so many genetic problems, the causes, biological, environmental, substance abuse, and the traumatic experiences of life. So the treatment also, we need to approach it from different aspects, from different fronts. First is regular self-help. In order to have a good mental health, we should be exercising regularly, getting enough sleep, spending time with our family members, friends, because it will help us improve our mood. And also with this day and age, the kids spend so much time on their electronics, like on the cell phone and like games. It is okay if it is in a some limited time. And we should not be like expecting the kids not to have any like the games or like the cell phone time, all those things, as long as they're doing appropriate activities, obviously. But if any misuse or any excessive use of like electronics can lead to the, poor mental health, because it will interfere with their sleep, their social obligations, whether it'll be school, or the family obligations. And it is becoming an addiction also, like the internet use. So counseling, Maulana Shamshad here, inshallah, he will shed more light on it. So the counseling in the form of psychotherapy, which means like talking to a mental health counselor, professional, and there are different forms of counseling, like cognitive behavioral therapy, dialectical behavioral therapy, and psychodynamic therapy. Then there are some alternative medicines which we can use, like getting massage, acupuncture, hypnosis, meditation. In our religion, there's so much emphasis on tafakkur, like have some time for ourselves, just sitting and just pondering. That provides us meditation. Then medications are obviously there. They are called antidepressants. And there are lots of misconception about the antidepressants also. They'll be habit forming. People would go to the length to avoid taking medication. Like I tell them, like if you're having pain, you'll just go and take Tylenol just like it's an M&M or a Skittle. Like we don't have a second thought, because every medicine comes with a side effect. With the antidepressant, like being in this field for over 15 years, I can tell it does not have any long-term side effects or any like negative, because every medicine will have a side effect. Even Tylenol have side effect, right? We don't even think about taking it. But like, why suffer when there's something out available there which can get you some help and take you out of your misery? Then why you would delay that treatment? So antidepressants are there, and they can take some time, like a few weeks, to show some effect or complete result, but it is definitely a very important tool for the treatment. Then there are some brain stimulation therapies available, especially for the treatment-resistant depression, which are not getting better with the medications or other forms of therapy. So some brain stimulation therapies are ECT, we used to call it shock treatment. They give the shock to the brain, and they're transcranial magnetic stimulation. So there's some, again, we affect the brain activity because of the magnetic stimulation. Or another one is vagus nerve stimulation. So there are different forms of treatment available. So if you will go look at this slide, so we talk about all of these things. Exercise, then have a proper schedule, taking care of our health, vitamin, relaxation, meditation, getting enough sleep, positive thinking. We'll cross out this music with manqabat and nahas. Then travel, inshallah, going to ziyarat and other places in nature also. Having a healthy, balanced diet, staying in communication with our family members and friends, and obviously medication and psychotherapy. So beside the treatment, the things that we can do, like we have touched it earlier, try to be active, physically active, and have exercise, set realistic goals for ourselves, try to spend time with other people and confide in trusted friends or relatives, especially if something is bothering you, if you're going through some stress. Instead of bottling it up inside, you should share it with the people who can give you good advice. Try not to isolate yourself and let others help you. Expect your mood to improve gradually, not immediately, because person does not get depressed overnight. It's not like they get an infection and the next day they will be depressed. Usually there is a timeline before getting to that point. So the result will also take some time to get back to the baseline. So you have to be patient. If you're taking a medicine and you're not getting better in a few weeks or a couple of days, sometimes the medication is not as effective. We probably need to change the medicine. But again, you have to be patient. And while we're going through depression, we should postpone making important decisions like getting married or divorced, changing jobs until we start feeling better, discuss decisions with others who know you well and have a more objective view of your situation. And again, continue to educate yourself about depression. So some preventions to increase our resilience and boost your self-esteem. So we have to work on ourselves. Like in order to improve our physical health, we go to gym and do all those activities. For mental health also, we have to work on increase our resilience, our self-esteem, reach out to families and friends, get treatment at the earliest sign of problem. The more we delay, the harder it will get to come to the baseline. And consider getting long-term maintenance treatment to help prevent a relapse of symptoms. And in the end, inshallah, Allah has mentioned in the Quran, Allah bi dhikrillahi tatmain al-qulub. Truly, only through the remembrance of God do heart find peace. So, again, there's no better, I think, treatment than this, inshallah. Thank you. Allahumma salli ala Muhammad wa ala Muhammad. Any questions here or online?
We have, but we'll do it after.
Okay, inshallah. So should we get the Dr. Sadaf?
Yes. Okay, thank you. बहुत शुक्रिया Dr. Mustafa Azadi for your discussion on depression, which I think is very important to identify who has depression, and then as he suggested, to seek treatment. We'll get him back, Dr. Mustafa, to discuss about substance abuse, but for the time being, we'll switch to another wonderful speaker, Dr. Sadaf Javed, who could not come here physically because she's not feeling well, but will be speaking to us through the telephone, and I'll give her a call in a second. She is a board-certified psychiatrist, both in child psychiatry and adult psychiatry. So that's very unique. She is a psychiatrist for children. So often people realize that, don't think that children have psychiatric issues, but children do. So she's very experienced in handling children with psychiatric issues, and she can definitely treat adults as well. And she has a practice here in Houston. I've known her for a number of years. So let me give her a call and see what she has to say to us about anxiety as well as about children's psychiatric issues. Yes. We'll do Dr. Mustafa Azadi again and get him talk about substance abuse. Hello? Hi, you're available? Let me put you on speakerphone. Oh. Hello? Are you available? Okay, I'll put you on speakerphone. So you can speak.
Okay. Assalamualaikum everyone. Bismillahirrahmanirrahim. Thank you, Hasan, for giving me this opportunity, and I apologize that I was not able to come here in person, not feeling my 100%, so I didn't want everyone to be around me get sick. It's very, very important that you guys have set up this platform to raise awareness of mental health. And, I've been practicing 6 years, almost 6 years in Houston, and these past 2 years, I have never been this busy. I see anybody from 6 to 65, and I have seen children and adults of all ages with all different kind of pathologies. And I also feel that in hindsight, this pandemic has definitely a lot to do with the mental health awareness. And I don't know if many people will agree with this, but I also feel that it is kind of like a blessing in disguise, because the world kind of slowed around us. So we had a little bit more time to self-reflect and to be aware of our own feelings and emotions, especially living in the United States, where we are always hustling and bustling. I'm a mother of 3 kids, having a practice and children. We tend to ignore our mental health. As the previous speaker very well said, that mental health is as important as your physical health, if not more. So I would like to touch upon anxiety. I feel we all are in a state of fight or flight for the past 2 years, more so. And I have been really seeing a lot of children as young as 4 coming in my practice with symptoms of anxiety. So, we all, I feel like everybody's middle name is stress here in this country. And I just kind of want to touch upon the definition of anxiety and what really is anxiety. And I feel it's very important to understand what, the literal definition is fear of the unknown, right? And in the way I explain to my patients is there is something which is called normal anxiety, and then there is something which is called abnormal anxiety. And I'll just explain to you the difference in just a second. Normal anxiety, we all need it, right? We all need to get our chores done. We all need to get our patients seen at the different responsibilities that we have. We have to make sure that we have to do them in a timely manner. So we need that little bit of anxiety to get things done and to wake up your kids on time, to be at a doctor's appointment on time and everything. That is fine. Now, the abnormal anxiety is something which, when it starts affecting your day-to-day living, these overwhelming feelings, like you start getting overworked and stressed about little things, when it starts affecting your grades, for example, in children, when it starts affecting your social relationships, and then finally when you start having physical symptoms, I feel like that, in my definition, is the pathological anxiety. And we need to be aware of the fact that there is a very fine line between normal anxiety, which we need to survive in this unpredictable world, and the abnormal anxiety, which is pathological. So, I always like giving examples of the patients that come in my practice, because I feel like maybe a lot of people sitting in the audience might relate to it. So, very recently, I saw a 6-year-old boy. Parents brought him and they said that he has been extremely irritable, crying at everything. He used to be a very happy kid, but the past 2 years, he's just been more and more withdrawn. He was homeschooled in the entire 2020. And the kindergarten year, which is the most important year in children's development in terms of their social development, he was basically home, right? And then when he started first grade, going to school in a mask, the wearing a mask in itself also is difficult because the children don't see the facial expressions and they don't learn the social cues. This little boy became more and more withdrawn and more irritable, throwing things, temper tantrums. And when we think about anxiety in children, we always wonder what are the key things that we are looking for, right? Because anxiety in children presents very different as compared to the anxiety in adults. So the key things that we kind of look for in children would be the mood irritability, right? Temper tantrums. Every morning he would make excuses like, I have a stomachache, or crying, not leaving the mother, not wanting to be dropped off at school. And then the nurse would be calling in the middle of the day that he's just crying, he needs to be picked up. So, it's very important for us parents to be understanding of the emotional cues that our children are giving us, right? These parents kind of understood that this child's behavior has changed very dramatically. From a happy-go-lucky child, he's become this very withdrawn, irritable child who did not want to leave sight of his parents. So what do we do in such a situation? I think that the most important thing is communication. When you are treating psychiatric disorders in children, it cannot be treated by one person. There has to be a holistic approach, right? You have to involve the school. You have to involve the psychologist or the school counselor, the teachers, parents. Everybody needs to come up with a plan to understand the behaviors of this child, understand the problem, and then fix the problem, right? Now, for younger children, I'm not a big fan of medications in younger kids. In this particular child, what we did was we came up with a plan, and we started play therapy, right? And so that these children can be able to express themselves through play, drawing, writing, and so far he has been improving. He now goes to school every day. The one thing that I always suggest to parents is give 15 minutes to 30 minutes with your child right at bedtime when you are putting your children to bed. Have a talk with them. Now, whatever age they are, and I'm going to give you guys two examples of a younger child and an older child with anxiety. So for this particular younger child, for example, talk to them. How was your day? What was the best thing that happened to you? What was something which was not so good that happened? If you are upset, what can I do to make you feel better? Right? Encouraging them to understand why they are feeling a certain way and to help them problem solve. Right? I think problem solving is something which should be really taught to children from a young age, and make them understand. Like when I'm introducing myself to children who come in my practice, I always tell them that I'm a feelings doctor. How important are your feelings, and what could be the consequence of a negative feeling versus a positive feeling, right? And making it okay to talk about. In our Desi community, we don't talk about feelings that much, right? I think it's very important to encourage our children and of course our adults to understand your own feelings and to be able to talk about them and ask themselves questions. Okay, why did I act like this? Why was I so scared of this situation? And what could I have done differently, right? So this is just a little scenario that I wanted to tell you about anxiety in younger children. I'm also seeing the opposite end. I'm seeing a lot of high school children, and I'm seeing what I've noticed in my practice is before I did not have a lot of Pakistani, Indian, like Desi patients. But I think since the pandemic, there's been a little bit more awareness. I'm seeing, and people are okay seeking help. I've been seeing a lot more children from Desi communities coming up to me asking for help. So this particular child is a 16-year-old, and she started cutting herself. Now, when we talk about cutting, it's basically self-harm, right? And when children do something like this, it's either a copycat behavior, because children are talking about this in school, or it is also considered, which is not the right form of soothing, right? Coping mechanism. It's a negative coping mechanism. So this 16-year-old had been cutting, and of course she would always wear long sleeves, and her parents would not know what was going on. And then she just school refusal. I just don't want to go to school. I'm not good enough. I'm not smart enough. Turned out that she was being bullied in school. And she did not say to her parents, when she came to see me in the office, she talked about it. And I asked her, because this is a very important topic. Bullying has become extremely prevalent in our schools to the point that there was a child, a 12-year-old, who recently committed suicide because he was being bullied. And this child was being bullied. And she was forced not to talk about it because she was threatened. So, of course, the anxiety of going to school, grades are falling. she started resorting to cutting, thinking that this is going to help her. And then anxiety and depression usually go hand in hand in slightly older children. So, of course, decreased appetite, decreased weight, just isolating herself. So in this particular situation, of course, we definitely had to get the school involved. We had to get the counselors and everybody on board. I had to start her on anti-anxiety medications, as well as CBT, which is a specific form of therapy, which is usually indicated for anxiety as well as depression. And what we do is we need to teach these kids how to identify the illogical thoughts and replace them with something more acceptable, right? So the illogical thoughts would be over-worrying, catastrophizing. I have a cough, oh my God, I'm going to get COVID, oh my God, I'm going to be on a ventilator and die, right? One negative thought leading to another, and all of a sudden you have a full-blown panic attack, and you are just having all those physical symptoms that I talked about, decreased breathing problems. I think I'm going to have a heart attack. I am sweating, hyperventilating. And then a lot of times these children then end up in the hospital because it's very overwhelming for them. So this child was then started on medications, and bullying is something which is, again, as I cannot emphasize enough for our parents to make sure that they keep the communication going. They are vigilant about their children. How we get so worried about their physical health, a cough or a flu or something, you immediately take them to the pediatrician and you make sure that you're giving them medications on time. This is also very, very important to make sure that you are talking to them. And a lot of times, teenagers, they don't want to talk to their parents. They just want to stay kind of doing their own thing. So we have to figure out ways where we involve our children in different activities. So one thing that I always suggest is make sure that you guys have at least one meal together, whether it is dinner or lunch, one meal during the day, and that's the time where everybody talks. And that's the time where you have an open communication. So that's the anxiety in slightly older kids, like the preteen to the teenagers, and they do really well with medications. A lot of adult medications which have FDA approval, they also have FDA approval in children, and we monitor them. We send them for therapy. We monitor medications monthly. We make sure that they're growing. We make sure that they have all the resources, and we just make sure that we tell them that there is help. There is help available. Nobody has the right to violate you guys. Nobody has the right to disrespect you, and we teach them to learn to speak up. So that's where the anxiety that's what I wanted to talk about in terms of anxiety in children. Any questions, Hasan?
No, thank you very much for this. Was, I think, very insightful. We have options of asking questions. Either the audience can ask, and we also have a.
We have after the if you're gonna.
Is there anything in particular? Because I know that you had mentioned anxiety. You had also mentioned me to talk a little bit about OCD.
Yes, if you can say a few things about obsessive-compulsive disorder. When people want to have an urge to clean themselves again and again, and make sure.
Yes.
So if you can just say a few things.
Absolutely. And, OCD is, again, all these things come under the umbrella of anxiety, right? Social anxiety, OCD, general anxiety, stranger anxiety, which is a normal part of development in young babies, 8 to 12 months old.
Let me interrupt you. Can you just explain us what is OCD so people have an
Yes.
idea?
Absolutely. So OCD is a very common but not very easily diagnosed a form of anxiety. What is OCD? OCD is Obsessive-Compulsive Disorder, right? Now, what happens in OCD is you have these obsessive thoughts. Like I'll give you examples because I feel like it's easy to understand when you have examples, and these are everyday examples. You have these repetitive thoughts in your head, right? So I have to wash my left hand 3 times and my right hand 3 times, and if I don't do it, I will continue to be anxious, right? So in order to relieve myself of that anxiety, I am compelled to do these physical activities, right? Now, there is a lot of times OCD is also very loosely used, right? OCD does not mean like if somebody is clean, or somebody keeps their work area clean or their house clean. That does not necessarily mean that they have OCD. That could be a personality trait, right? OCD is a pathological condition to the point that you talk about najasat, for example. We are sitting. We are in an Imam Bargah. We all being pure and clean is a part of Islam. And I'm going to take that route because I have a particular patient in mind who I'm treating for OCD. So you have those obsessive thoughts repetitively in your mind to the point of it affecting your day-to-day living. There are patients who spend hours and hours in the bathroom because they are unable to get that thought out of their head that they are unclean. And this affects their day-to-day living. It affects their social life, their relationships, their academic performances. So, and the only way these thoughts get out of your head is by you actually performing the ritual. These different habits are basically rituals. I need to take 10 steps to reach to the door. If I take 11 steps, I'm going to go back and take 10 steps again, right? And they are insightful of the fact that this is damaging to them, but they unfortunately cannot control them. And this pandemic has opened up literally a Pandora's box of anxiety disorders, of which I personally feel that there are 2 types of patients. The patients who never had anxiety and OCD, it came out because of the repetitive information that was given to us. Wash your hands, wear a mask, avoid crowds. Literally, there are patients who were fine, were living a normal life, and after this pandemic, they've literally been isolated to their houses because of the OCD that came out. And then there were patients who already had OCD, and their OCD got extremely worse. I see a Muslim girl who is a student at University of Austin. She literally, when she started seeing me, she used to spend 4 hours in the bathroom doing wuzu. 4 hours for one namaz. And first of all, it would take a lot for her to actually go to the bathroom because she knew that she's going to take a lot of time. Even if her hand touched the sink, she would start all over again. So it got so worse that she had to stop studying. She had to take a whole semester off. And when she would be praying, she would do one surah, and in her mind, she would be like, oh, I don't think I did it correctly. So she would take a couple of hours to do one namaz, and then she would be ready for the other one. So she would literally be spending either the whole day in the bathroom or the whole day on the jai namaz. And you think about it, this is a functional, intelligent, girl who wants to be someone in life, and now she is kind of confined to her own room, and she is just 17 or 19 or 20. So right now, of course, she's medicated, and she is. And I just want to let you know, in case somebody is interested, there are a bunch of, and this is something I learned myself, religious therapists who help patients who have OCD and who have religious preoccupations to their OCD. This particular therapist that I'm talking about, she lives in Maryland, and this is what she does. She only helps patients who have religious preoccupations and who are suffering from severe OCD. So now this girl is doing a little better. Of course, she is not where we would want her to be, but at least she is now able to imagine. When I met her last time, I said, okay, so how much time are you spending in the bathroom? And she said, I'm spending an hour. And you think of it, oh, okay, she's spending an hour in the bathroom doing wuzu, and versus 4 hours. So for us, one hour is a lot as well, but for me, it was a step in the right direction. So OCD again is very important for us to know about. It's very important for us to recognize. It can be very debilitating, but there is help. There is help if you feel like, okay, you might have somebody in the family who has these issues which affect their day-to-day living, affect their schoolwork, affect their social relationships. Please seek help.
Thank you very much, Sadawat. Excellent presentations. I wish you could be here in present. We wish you all the best for your health. There have been some questions. I'll take some from the audience first, if not there. There are plenty questions on slido.com, number 720174, if somebody is looking, and there are a lot of questions. If you are on slido.com, if you click the questions, whether you like it or not, so we can go with that first. Any questions in the audience? Yeah, please go ahead. You have a mic. Malaikum salam.
Is it work? Okay. Okay. So my question is that now the times are changing. There's so many distraction for the kids. How do we figure out, whether there is an issue with a kid being focused, in school and studies, or this may be just the time you're living, with so much distraction? It may be a normal behavior, or could it be ADHD? I mean, so for parents, is it how do we go, figure out, if the kid may actually need some help? Maybe ADHD may also have different levels.
Right.
So that's what I'm trying to.
Were you able to
understand.
listen to the question, or
Yes,
do I need to repeat?
yes.
Okay, go ahead.
Yes, that's a very good question, and I get a lot of ADHD evaluations, and I've been getting a lot of adults who are coming and asking me, maybe I had ADHD as a child because I'm struggling, right?
Okay, can you maybe explain what ADHD itself is?
Yes, absolutely. So what is ADHD? ADHD is problems in 3 areas, right? And I'm going to make it very, very simple for everybody to understand. I don't want to bring any medical jargon. So we have inattentiveness, we have hyperactivity, and we have impulsivity, right? Now, inattentiveness, as the name suggests, of course, my child is unable to focus, right? Now, even us as adults, there are so many times where we lose focus, right? There could be thousands of reasons for children to lose focus. It could be just a bad day that they are having. So it is not something that just develops one day. right? They have to consistently have the focus issue. Teachers would consistently be calling them that, he knows the stuff, but he's unable to reproduce it because he's not listening or he's not paying attention in class, right? So that's the inattentiveness. The hyperactivity, again, I think hyperactivity is also so overrated because, children are children. They will not sit still. They will move around. But I think the most important thing is the hyperactivity when you are asked to sit down and you are still constantly, any part of your body is moving, or you're constantly getting up from the chair. You are being told by the teacher that, just sit down, or you're tapping the pencil on the table, or you are, you're fidgety. And a lot of times these children don't even realize that they are moving so much, and they get in trouble a lot, right? And then the third thing is the impulsivity. Now, the impulsivity is something that people don't talk about much in ADHD, but I feel that impulsivity is a very, very important part of ADHD. What is impulsivity? In boys, the impulsivity comes out as aggression. Oh, he pushed the boy in front of me, or he blurted out answers. He didn't say excuse me, he just rushed by, because their brains are running so fast that it is difficult for them to get those thoughts, first of all, in order, in a timely manner. It's like you see a squirrel trying to cross the road. If you observe a squirrel for literally 5 minutes, you yourself will feel dizzy. That is really the true ADHD. And the girls have more inattentiveness. Girls don't really have the anger issues or the impulsivity or the pushing or the shoving. Boys usually have more the hyperactivity and the impulsivity. Now, the question that you asked is, okay, is this what? Again, there is a fine line between ADHD and normal development, right? So ADHD is a clinical diagnosis, and whenever I'm diagnosing ADHD, I'm speaking to the parents. Then I also speak to the teachers, and my thing is consistent hyperactive behaviors or consistent struggling in school, even though the child wants the help, or the child knows that his brain is working so fast, and if you talk to them, if you explain to them, they understand. So basically that's what ADHD is about. So we interview the teachers, I interview the parents, we interview the child, and it comes across, we diagnose it as a holistic approach whenever we talk about ADHD in children.
Thank you.
Hey, Dr. Sadaf, this is Dr. Mustafa. I think you will probably agree. Whenever we are dealing with any mental illness, especially the ADHD, I think the most important thing is their functionality, is effect in their occupational, educational, and social. Right. So if there's a problem there, then it's more, because otherwise it's just normal child hyperactivity or inattention. But when you see the problem in their productivity, whether it'll be at the school for the kids or the adults at their job and the home, and it has to be in 2 or more settings, right?
Absolutely. And the fact that, I personally feel that it's very important if you feel that, I had a patient, the mother was in denial. A Desi mother, she was in denial. She didn't want to give the child medications. This child was floridly ADHD. When he came in my office, he was going round and round on the chair. I had to make him sit on the sofa. Everything, like sticky fingers, touching everything, holding everything. He was. And what happens is that these children, then they fall back in school. They fall behind. And then they start thinking that they're not good enough. And they are not smart enough, because everybody understands, everybody is able to finish in 30 minutes. Why does it take them 2 hours to finish homework? And it's an actual disorder, and there is help for it. And again, I always talk about just be proactive, just try to talk to the pediatricians, because usually it's the pediatricians who refer patients to me when they think that the kid might have issues. And I just very briefly, I also want to talk about learning disorders. And a lot of times they keep on pushing the child. Oh, he can't focus. My thing is, if there is somebody who does not understand what is being taught to them, of course they won't have the attention. If you give me a book in German, I don't understand German, I'll probably throw the book out of the window, right? So we also have to keep learning disorders, dyslexia, dyscalculia, math, learning disabilities in mind when we are talking about ADHD. So that is something that I think is also extremely important.
Excellent points. There's a question from the Slido.com. How to treat teenage boy who is shy in front of people and have problem with eye contact other people. And by the way, before this, if you can just give some brief treatment guidelines for ADHD.
For ADHD?
Yes, treatment guidelines for ADHD, and then how to treat this particular boy.
Right. So ADHD it's very simple. You have the stimulant medications and you have the non-stimulant medications. So, for example, you see this 10-year-old boy. Parents tell me that he's been struggling, but we were able to manage. Now he's in middle school and he's really falling behind, and maybe we should have come earlier. He knows the stuff, but he just takes a long time. He forgets his homework. So then I'm talking to them about medications, right? So we have the stimulant medications and we have the non-stimulant medications. Now, what are those medications? The stimulant medications is, for example, I'm going to give you the example of having a cup of coffee with a shot of espresso. We've all had tons and tons of chai and coffee before our exams to keep us awake and to learn better, right? What these stimulants do is they go inside the brain and they work on the dopamine receptors, which is like the awaking area of the brain, and they kind of awaken your mind, right? And really nobody still knows how these stimulants work, but everybody must have heard of Ritalin. I'm sure everybody must have heard of the medicine called Adderall. Because it's a street medication, it has street value. So these stimulant medications are, again, it's a physician preference. I personally give this medicine called Concerta, which is a better form of Ritalin to younger children, and older children I like giving them Vyvanse, right? These are just the names I'm throwing at you. They go inside the brain, they help in sustaining attention for at least 8 to 10 hours, the long acting, and then you only give these medications to them Monday through Friday when they are in school. I usually don't encourage parents medicating their children during holidays or vacations or the weekend, right? And then the second set of medications are the non-stimulant medications, which is one medicine is called Strattera, and the other is the Intuniv and Clonidine. Now, they are medications which don't cause weight loss. The stimulant medications decrease the appetite, so parents are usually not very comfortable giving medications that decrease appetite and might stunt growth. But we are always monitoring the weight and the height, and we make sure that these children are growing appropriately, and they really make a big difference. And parents come to me and the children's behavior is so good, they are listening, their grades have improved, their self-esteem and their self-confidence is up the roof, and they start loving school again, right? So and most of these medications are FDA approved for children 6 and above. In fact, I had somebody medicated. I didn't do it, but this kid was 4 years old and was on ADHD medications because his ADHD was so bad that he almost lost his life. He crossed the road and there was a car coming from both directions. So regarding the teenage boy who's shy, I get that a lot as well. Social anxiety is something which is very prevalent in our society, primarily because of social media, because of children hiding behind computers and their iPhones and tablets. It's easy to talk to somebody on the tablet rather than having an actual conversation with somebody face to face, right? Because unfortunately, this is where our world is right now. Our children are hiding behind their computers literally all day long. So this particular child who's having a social anxiety, I would suggest there are a bunch of these social groups. And we have a ton of resources. We just have to ask for them. Social groups where they are encouraged to sit with a moderator and have conversations, actual conversations. So those are social anxiety groups, and there are a lot of therapists and counselors throughout the city of Houston, which offer all kinds of services for children. So I would strongly suggest look into that. Encourage him to go out and speak. Okay, you go to the store and can you get this for me? And that would be something to start off with.
Thank you. There is a question for a guardian. When is the right time to start a medication for the treatment? Some doctors suggest medicines early, some are against due to side effects. And also maybe you could touch upon the stigma of using medicine also and trying to just treat by nature, natural therapy, as well as the compliance, because once they get better they stop, that kind of thing.
Absolutely, and that is a very good question. And as I told you, I'm a mother myself. I have 3 kids, and every time I'm talking about medications to my patients, I always tell them that I would not start anybody on medication until and unless I absolutely have to. Right now, as Dr. Mustafa also said, anytime